Hello, I'm Dr. Igor Simonov. Today I will show you how I use pulse diagnostic method from the chapter 5 of Nanjing 81 Difficulties of Chinese Medicine. For recording the pulse diagnostic, I use the PulseMap method. Here we have the pulse map of patient who came with nausea and the diarrhea. This pulse map shows us different sign organs and the full organs. So here we have the lung, heart, spleen, pancreas, liver, right kidney, left kidney. And here we have the full organs: large intestine, small intestine, stomach, gallbladder, triple wormer, sanjiao, and the urinary bladder. Pulse diagnostic was taken manually, and here we have the records of that. So what actually PulseMap can show us? It shows us that the large intestine, lung meridian has some penetration of the pathogenic energy, some excess here. Spleen, pancreas meridian, also has some penetration of the pathological energy in this meridian. We also can see the liver meridian deficiency and left kidney meridian deficiency. And we see here some stagnation in the pancreas, spleen meridian, as different organs they actually on the same level as the spleen. Here we see the full organs. For example, we can see that there is not any excess, not deficiency, there is not any stagnation in these organs either. So most problem is happening in thine organs. PulseMap and the pulse diagnostic actually show us not just what the problem patient has, but also how we need to treat, what the treatment we need to apply. Of course, here we can see, first of all, we need to stimulate deficiency of kidney and the deficiency of liver meridian. Second, we need to prevent following penetration of the pathological energy in the spleen and the lung meridian, and disperse this energy from the lung and the spleen meridian. We also can see what kind of pathological energy is penetrating in this meridian, because in the spleen it is the cold, because it's at the same level like the water, and in lung meridian is the dampness, because it is the level of the spleen, pancreas meridian. Pulse diagnostic, PulseMap show us also how we can treat, which points we need, acupuncture points we need to use, because pulse diagnostic is like the language in which body of the patient talk to us. So as the lung meridian show itself on the level of the pancreas, so we need to use the earth point on lung meridian, point number 9 of the lungs, and the number 5 in spleen meridian, pancreas meridian. We need to use number 9 of the pancreas meridian, because number 9 is the water point, and it's the level of the water of the kidney. And we need to use number 3 on kidney meridian, because the earth, this pancreas spleen meridian is the earth. So we also need to use number 3 on liver meridian, because it's the level of the earth, and number 1 in spleen meridian, because the liver is the wood. And we need to use again number 3 and kidney meridian, number 9 in spleen meridian. And here we can see actually in just the diagram of the 5 movements that mostly, which is affected most the connection with the different meridians is the spleen. So mostly what we need to treat here is the spleen. Also we have another patient also who came here with the diarrhea and the vomiting. Despite the same symptoms, we can see that the PulseMap is absolutely different, because the pulse diagnostic shows the very different condition of this patient. He is not any problem in the meridians of the Zhang organs. They are all balanced without excesses. All the pathology, all the problem this patient has actually in 4 organs, and the PulseMap show us that here is deficiency in small intestine meridian, deficiency in gallbladder meridian, some excess penetration of the pathological energy in the triple womb Sanjiao meridian, and the penetration in urinary bladder meridian, and also some stagnation in the level of the stomach meridian. So in this case we need to treat, we need to stimulate gallbladder, small intestine meridian, and prevent penetration and disperse, in this case, the humidity from the Sanjiao and the heat from the urinary bladder meridian. And what points we can use here? For example, for small intestine treatment, we can use the 0.8 of small intestine and 41 of stomach. For treatment of gallbladder, we can use the number 43 of gallbladder and 65 of urinary bladder. And for Sanjiao, we use number 10 of Sanjiao and the number 44 of stomach. And the urinary bladder meridian, we use the number 60 of urinary bladder and number 2 of small intestine. Actually, yes, this same diagram, the same pulse diagnostic show us which particular points we need to use in this particular moment for treat this particular condition, and which means that actually we need to treat patients with what our pulse tells us, not what theory may be telling. So if we will compare this prescription of the points, they're particularly mostly the same as the classical books, and which means that patient come to the practitioner and treat himself through the practitioner, not some mental work of practitioner treat the patient. And what we can see here, despite the despite the same symptoms, this patient have actually absolutely different condition. Thank you.